Well, Reese is a very healthy, active young lady, and she was extremely active in sports. She had an unstable kneecap, which came from the fact that the groove that the kneecap normally travels in was very shallow.
I've been playing soccer ever since I was little, as soon as I could. Ever since the 3rd grade, I've had knee dislocations, and it's been bothersome having to be out every season, having to find a new goalkeeper because I was the only one on our team. I had to stand on the sideline and watch my friends play all the time, and I just kind of had to be the cheerleader on the side, and I couldn't really help or do anything. I just stood there. I felt kind of useless.
Reese's kneecap was able to basically shift wherever it wanted to, and that predisposed her to injury and to pain.
My dad told me he wanted me to meet Dr. Kazewych, and when I went to go meet him, he told me, let's take some x-rays, and we took them, and he told me that he could fix my knee problem. And at that moment, I was jumping with joy. It was the best day of my life. Everything was going to change from that point on.
I was able to dig a trough in the end of her thigh bone that would capture her kneecap and allow her kneecap to sit in its new home and track in its new space that I'd created for it. And I had also taken some tissues and reconstructed one of the ligaments which acts as a leash for her kneecap to help further stabilize the kneecap to keep it from shifting off to the side.
I had the procedure done on both of my knees. I had a Trochleoplasty and an MPFL, a Medial Patellofemoral ligament replacement. It took 6 hours, and recovery took just a little less than a year.
After surgery, Reese underwent several months of physical therapy because her leg has to get used to tracking in a different position. The muscles that were affected need to be retrained, and she essentially has to retrain her leg for sports.
I have no problems whatsoever. I've had full recovery. I'm looking forward to trying out for soccer this year, and without having to wear the large knee braces, knowing that my knees are perfect, and it's just well worth it in the long run.